Hi friends, welcome back to my channel Lab Learnings. Today I am going to talk about the most discussed topic in diagnostic industry, that is home visits or lab at your doorsteps. Now why home visits? I think it's the most crucial, and today with these times of corona where our mobility is restricted, we have all taken home visits into account for our health status checkup, isn't it? So, what are the precautions? What are the procedures and the steps in this particular visit or home visit as an SOP? I want to discuss about my own experiences both for the laboratory side and the patients. So, it starts with number one, booking of home visit. It can be done through the web or website of a lab, telephonically or on WhatsApp. I request particularly for my patients that please send your prescriptions either on email or on WhatsApp to the respective desk so that you do not skip on an important information and the test which is asked by your clinician. By there I mean fasting status, medications, what are other precautions related to diet before the test is done. Number two, very important, is the time. Looking at the time, there are labs which do home visits either from 8 to 8, 8 to 4, 8 to 12, 7 to 7 or 24 hours. So please look at those timings and book your home visit. I also request that give your proper address and a landmark so that the technician or the phlebotomist who is coming to your residence comes easily and is not delayed. So when with fasting, the most common question which is asked to us, Dr. Aparna, how many hours of fasting should I keep? So ideally it differs from test to test. As I said, the prescription is very important. But if you look at fasting blood sugar or insulin, it's 8 hours of fasting minimum. And if you're going for a lipid profile, now with revised guidelines, no fasting is required, but ideally 10 to 12 hours. Most importantly, most of our patients require or miss their early morning or a mid morning tea or coffee. Friends, that's not included in fasting. But again, water is allowed. No other drinks are allowed during this time. So I feel fasting means fasting after your dinner till the morning time when your sample is taken. Second most important thing is urine collection. I feel when the urine collection is the most crucial part in the testing of urine test, the first morning midstream sample is needed. So I request all my patients to collect and keep some of the containers from our lab in their house so that when they wake up in the morning, they can collect the midstream sample, put in a Ziploc container and keep it in the refrigerator till the phlebotomy appointment is done. The third most important thing is drugs. What are the drugs you are going to take? We will be talking about it, but in detail, talk to your clinician and find out which time what drugs need to be taken. The fourth most important thing where I generally do not encourage home visit is semen analysis. Semen analysis is very crucial pertaining to the time of collection. So I encourage my patients to come to the lab and give the sample. Obviously, some procedures like FNAC or cytology, a pre-book appointment with the lab and the pathologist is needed. I think when the technician comes and the time arrives for the home visit, it's better to validate and verify the ID card of the technician so that you know that representative person is there for the home visit. After the collection is done, again verify the name of the patient, the tests which are taken, and if all the samples are given to the respective technician. Most important after that, after you make the payments, is check how you want the report to be delivered. Do you want it on WhatsApp, email to you and your clinician? Because that's very important. And I always request, after giving the consent form to the lab, please write it on your own so that no alphabetical error happens in the email and the reports are delivered properly to the respective email ID. Now here is the most important point, that's about the drugs which I mentioned. Most of our patients are on either hypothyroid and are on treatment of hypothyroidism, anti-diabetic drugs or antihypertensive. Fasting and these drugs have no correlation. Please do not miss them unless indicated by your clinician. So after the visit is done, the most important, like 40 to 50% of the visits in Asavali labs are around postprandial mixed visits. That means post lunch. I urge and request all of you to please inform what time will be the collection for the post lunch. Say for example, if you are starting your lunch at 12 noon and finishing it by 12:30, the time of collection for the postprandial will be 2:30. That means 2 hours after your lunch is completed. With that, as I mentioned, home visit should be utilized properly, judiciously, so that you do not miss the timing, the drugs and the tests mentioned by your clinicians. Communicate to the lab and instruct them as per your prescription. So with this, we come to the end of our topic, home visit. If you like our topic, please subscribe and share our channel Lab Learnings. Till then, stay safe and stay healthy.